Welcome to SCPS Medication Policy and Procedure Training. The purpose of this training is to educate SCPS personnel on district medication policies and procedures. Upon successful completion of this course and quiz, you will be authorized to give medication to Seminole County students. Annual renewal is required. Our medication policy is based on Florida Statute 1006.062. This law states that students who require medication during the school day or during school-sponsored activities must receive their medication. We will start first by defining some terms for you. A licensed healthcare provider is a licensed professional with prescriptive authority. This includes doctors, physician's assistants, nurse practitioners, dentists, and orthodontists. It does not include nurses, PhDs, nutritionists, and/or chiropractors. If in doubt, contact your school board nurse. A school board nurse is a professional licensed registered nurse. Each school has an assigned school board nurse who is shared by multiple schools. A clinic assistant is typically an unlicensed, non-medical SCPS employee trained by the school board nurse to perform clinic duties. They are not nurses and should not be referred to as such. Prescription medications are medications that require a written prescription from a licensed healthcare provider. Examples are medications for attention deficit disorder, antibiotics, or asthma inhalers. Over-the-counter medications can be obtained without a prescription. These may include Tylenol, Advil, cough drops, medicated lip balm, and sunscreen. Emergency medications are medications used for life-threatening conditions. State laws allow all students to carry and self-administer metered dose inhalers, epinephrine autoinjectors, insulin and other diabetic supplies, as well as pancreatic enzymes with written parent and healthcare provider permission. Who designates and delegates medication administration? Statute 1006.062 states that the school principal designates who will give medication. Based on this same law, the school board nurse must provide medication administration training for the designees. Administering medication is a procedure that the nurse delegates under the Nurse Practice Act. Therefore, the designee is administering medication under the nurse's license. There is no liability if you act as a reasonably, ordinarily prudent person would have under the same or similar circumstances. Who can administer medications? Any SCPS employee who has current medication training may give medications. A parent or guardian may give medication to their own child. High school students are permitted under our policy to carry and self-administer prescription and over-the-counter medications with the appropriate authorization. Middle school students may carry and self-administer over-the-counter medications with the appropriate authorization. Elementary school students may carry and self-administer the 3 approved over-the-counter medications with the appropriate authorization. Florida Statute 1002.20 allows a student of any grade level to carry and self-administer emergency medications with the appropriate authorization. These medications again include epinephrine autoinjectors, inhalers, diabetes medication and supplies, and pancreatic enzymes. All medications, both prescription and over-the-counter, to be given by school personnel requires completion of an SCPS medication authorization. This is true for all grade levels, elementary, middle, and high school. The form must be completed by a licensed healthcare provider as previously described and signed by the parent or legal guardian. This form is only valid for 1 school year, including summer school. The school board nurse should be notified each time a new authorization is received. Any student permitted to carry and self-administer medication should be given a copy of the authorization to keep with them. School personnel are not permitted to honor independent requests from a parent or legal guardian to administer prescription medication other than as specified on the authorization. Any incomplete form should not be accepted. Medication should not be signed in until a completed form is obtained. Any questions regarding the form should be directed to the school board nurse. This is an example of the Medication Authorization Form 157. All lines should be completed. The first line indicates what condition the medication is being given for. The next line states the name of the medication and its strength. For example, methylphenidate 10 milligrams. The medication name and strength should match exactly what is on the bottle. If a generic brand is substituted, the original prescription brand name should still be listed on the bottle. Next is the route. This indicates how the medication is to be given. The most common routes are oral, inhaled, injected, or topical. The school board nurse should be notified immediately of any orders requiring medication to be given by injection or rectally. Dosage is the total amount of medication to be given. For example, half tablet, 10 milliliters, 2 inhalations or puffs. Frequency describes how often the medication can be given. Examples would be daily or every 4 hours. When giving as-needed medications, you may need to contact the parent to see if a dose has already been given at home. Time of day is the prescribed time when a medication is to be given. For daily medications, during school hours, you have a window of 60 minutes before and 60 minutes after to give the medication. If that time frame is missed, it cannot be given. The person designated to administer medication is responsible to ensure it is given on time. Every effort to find the student needs to be made to give the medication within the allowed time. If a medication dose is missed, the parent must be notified. As-needed medications require an indication or symptoms as to when the medication should be given. For example, for an asthma inhaler, this might state, for coughing, wheezing, or shortness of breath, or use inhaler 20 minutes before exercise. Potential side effects of the medication should also be listed on the form. Students who will carry and self-administer emergency medications must also receive authorization from their healthcare provider to do so. This is indicated on the form by checking the appropriate box.
This is an example of the Allergy Medication Authorization Form 1552. All sections should be completed. The first line indicates what the student is allergic to. This could be foods, insects, or something environmental. The second line is to share previous symptoms that the student may have experienced in the past when exposed to the listed allergens. It may be noted that the student also has asthma. If this is yes, then the student has a higher chance of an allergic reaction. It may also be indicated that the student has had an anaphylactic reaction in the past. The next section indicates whether the student has been authorized to self-carry and/or self-administer an epinephrine autoinjector. If the student is authorized, the healthcare provider should indicate what education has been reviewed with the student. Next is the epinephrine medication. Here, the provider can indicate the brand or generic name. The strength of the epinephrine is needed and should match the medication that is delivered. The provider should indicate the symptoms as to when the initial dose of epinephrine should be given. For example, for difficulty breathing or swelling of the face or tongue. The provider may also indicate if a second dose should be administered, if available, and when to do so. The provider may approve use of an antihistamine as needed. Be sure the name, strength, dose, route, frequency, and for what symptoms are all completed. Be sure the licensed healthcare professional's signature and information are present on the form.
Middle and high school students may carry and self-administer over-the-counter medications with proper authorization on an SCPS Form 160. Elementary school students may only carry and self-administer the 3 approved over-the-counter medications listed on the authorization. Each over-the-counter medication requires its own authorization form. Items such as cough drops, sunscreen, medicated lip balm, and bug spray are considered to be medications because they may contain active ingredients that have the potential to cause an allergic reaction. Vaseline and contact wetting solution are not considered medications and can be carried by all students without an authorization.
This is an example of the authorization for over-the-counter student self-administered medication Form 160. The 3 approved elementary options can be indicated in the top smaller boxed section. For middle and high school, the parent should indicate the name of the medication that the student will be carrying and self-administering. Only a parent or legal guardian signature is required on this form. No healthcare provider signature is needed. This form must be kept on file in the clinic and a copy given to the student to keep with the medication at all times. The student must carry the medication in its original container and should only carry 1 day's dosage at a time. Students authorized to carry and self-administer over-the-counter medications may not store the medication in the school clinic.
Medication authorization forms 157, 1552, and 160 are all available on the SCPS website under Health Services, Downloads and Resources. You may encounter other authorizations that are condition-specific. Please notify your school board nurse if you receive any. These might be authorizations for diabetes management, seizures or epilepsy, complex medical procedures, or other conditions. So let's break it all down. At the elementary school level, all medications other than the approved over-the-counter products require the healthcare provider completed authorization 157 or 1552 form. This includes medication given by school personnel as well as emergency medications that the student is authorized to carry and self-administer. Other than the previously stated emergency medications, inhalers, insulin, epinephrine, and pancreatic enzymes, and the 3 approved over-the-counter products, elementary school students may not carry or self-administer any other medications. At the middle school level, Forms 157 and 1552 are used for any medication given by school personnel, as well as any of the emergency medications the student is authorized to carry and self-administer. Form 160 is used in middle schools for students to carry and self-administer over-the-counter medications. At the high school level, Forms 157 and 1552 are used for any medication given by school personnel, as well as any self-carry prescription medications. If a high school student is permitted to carry and self-administer their own prescription medication, the physician must also indicate this on the form. Form 160 is used for any self-carry over-the-counter medication.
The student self-carry prescription medication log is a document that will be completed by the school board nurse when the medication that the student is carrying is reviewed and verified. A copy should be kept in the clinic and uploaded into the student's Skyward Health record. If a medication needs to be given to a student who has no medication authorization form on file, a parent or legal guardian may come to the school to administer medication to their child. If the parent or legal guardian are not available to come to the school to administer, an adult who is authorized to check the student out may do so and then check the student back into school. This is an example of a parent-administered medication form. When a parent is going to administer medication to their own child, the student should be called from class and the med should be administered in the clinic. The parent is to fill out the form indicating the name of medication, date and time that the medication was given along with their signature. This form can be used throughout the school year for the same child. It can also be used for more than one medication. It should be uploaded into the student's Skyward Health record once it is full or at the end of each school year. Medication to be stored at school must be hand-delivered.
A parent or legal guardian may deliver medication to the school for his or own child, or they may designate another adult to deliver the medication. This adult must present written permission from the parent or legal guardian using a permission to transport form. At the high school level, students may deliver their own medication with parent permission. However, no elementary or middle school student may deliver his or her own medication. If this occurs, the medication should be brought back to the clinic designee and the parent contacted to pick up the medication or sign it in. Use the Accepting Authorizations Medications checklist each time a medication is being delivered to be sure all criteria is met. Do not accept any medications without an authorization. However, you can accept authorizations prior to the medication being delivered. Be sure to check all the sections on the checklist before the parent or guardian leaves. The permission to transport form is used when a parent designates another adult or their high school student to deliver medication. It includes the medication name, strength, and number of pills, amount of liquid, or number of devices. Parents can write their own form, but it needs to include all of this information. The transport form is kept on file to assure the amount of medication signed in matches what was sent from home. A record of medication delivered to school is required by law. A separate log must be completed for each medication delivered to school. A pill count must be done and medication log must be completed and signed while the parent, legal guardian, or designee is still present.
When signing in new medication, make sure the name of the medication label matches what is on the authorization. If there is not an authorization on file or brought in with the medication, do not accept the medication. Indicate whether the medication is being checked into the clinic or being checked out back to the parent. Once the medication is counted, indicate the quantity being checked in or out. Remember not to rely on the quantity listed on the bottle unless it is new and sealed container. A physical count must be conducted while the parent is present to accurately determine the quantity being exchanged. If half tablets are delivered, count them as half tablets, but be sure to specify on the log. If it's a liquid, record the estimated amount in the bottle if not exactly known. EpiPens or other devices can be recorded as the number of units being delivered. Inhalers should be listed as to how many puffs are available. This can usually be found on the inhaler itself. Indicate the date and time the medication is being exchanged. The prescription number on the medication must also be recorded. If it is an over-the-counter medication or sample, you can record the lot number. Record the expiration date for each medication. Florida Administrative Code states that the expiration date should not exceed 1 year from the filled date. Dates that will expire during the school year should be highlighted. Parents should be contacted in the month prior to the expiration so the medication can be replaced. Persons receiving the medication and delivering the medication must both sign the record at the time of delivery.
Let's review what you will be looking for when you check in a prescription medication. Keep in mind, labels will vary from pharmacy to pharmacy, but all should include the following. A, the prescription number. B, the name of the healthcare provider or prescriber. C, the date that the medication was filled by the pharmacy. We require a current prescription and do not allow pills to be dumped in an old bottle. Remember that your expiration date will be 1 year from this date. D, the student name. It must be prescribed for that student. E, the name and strength of the medication. There should also be a brand name listed if replaced with a generic. F is the pharmacy contact information. G, the quantity of medication. Never assume that the quantity brought in matches the amount stated on the bottle. A count must be done at check-in. H, the number of refills that are left on the prescription. I, the manufacturer of the medication. J, the discard after or use by date. This would be the expiration date only if it occurs before the year from filled date. K shows directions or instructions for how to take or administer the medication. It is possible upon parent request that a pharmacy create a separate label for school use. When you receive a new medication, you should notify the school board nurse. She will enter the medication information into Skyward. Once the medication is in Skyward, you will need to enter the medication log information into the inventory section of that medication in the student's profile. You will need to add a record in inventory every time more medication is brought in or checked out by a parent or guardian. There is more detailed information on how to do this in the Skyward training. State law requires that all medications be stored under lock and key in an area designated by the principal. In addition to the clinic setting, medications may be stored in a classroom due to proximity to the student. These medications must also be stored under lock and key. If a medication requires refrigeration, it may be placed in a refrigerator with a lock on the door or in a locked box inside the refrigerator. Medication should not be exposed to food in the refrigerator. Daily temperatures must be recorded using the temperature log form. All expired medications need to either be picked up or discarded. Expired medications should not be stored in the clinic. Parents should be notified by phone and in writing that the medication is expired and giving them a time frame to pick them up prior to discarding. Also, remember, you may not store medications for students who are authorized to carry and self-administer. Remember and use these 6 rights of medication administration. First, right student. Assure the medication is being given to the correct student for whom it is prescribed or authorized. Second, right medication. Be sure the medication matches the authorization and is labeled with the student's name. Third, right amount. Give the correct amount of medication. This is the amount written on both the prescription label and the authorization form. Fourth, right route. The medication should be administered in the correct manner, whether it is oral, inhaled, topical, etc. Fifth, the right time. The medication must be administered within the 60 minutes before or 60 minutes after the prescribed time. Sixth is right documentation. Administration of medication should be documented immediately by the person giving the medication. Following these steps will ensure that you are the prudent person the law refers to. In order to administer medications correctly every time, the following procedure should be followed. First, wash your hands. Next, have the student identify him or herself by first and last name. If you are documenting in Skyward at the time of the visit, the student's photo might be available on their profile. Next, remove the medication from its locked location and check the name on the bottle. Check the medication label to compare with the authorization form. You should never give a medication without checking the authorization, even if you give it every day. Medication should be given as directed by the authorization form, not by parent word of mouth of a change that has not been documented. Once all information is verified, the medication can then be dispensed. If medication is in pill form, you may pour the medication from the bottle cap into the student's hand. If it's in liquid form, you may hand the medication cup with the liquid medication to the student. Always be sure that the student has swallowed the medication before documenting administration. Contact your school board nurse for the appropriate procedures for medications that are not administered orally. It's imperative to maintain thorough documentation. Each school must maintain a current record of all medications administered by school personnel or by the parent or legal guardian. Documentation is done electronically in Skyward. Within an office visit, you can administer scheduled or as-needed medications once they have been entered by the school board nurse. Remember, the window for administration of a scheduled medication is 1 hour before and 1 hour after the ordered time. Medication administrations given on school campus should be documented within an office visit. When a medication is given, it must be documented immediately. If it is not documented right away, someone else may think the medication was not given and give it again. Be sure to complete all necessary items when documenting the administration. Only document for yourself. Do not document for any other staff member who has access to document themselves. Remember, there is a 60-minute window on either side of the prescribed time to administer the medication. If not administered within that time frame, medication should be held, parent notified, and an incident report completed. Every attempt should be made to locate the student before the 60-minute window is up. If medication is ordered at 2 different times during a school day, there will be 2 schedules to choose from. Be sure you document on the correct schedule. If a range in dosages order, for example, 1 to 2 puffs for an inhaler, indicate how much was administered. Use the notes section to document anything else important like communication with a parent. More detailed information about documenting medication administrations is available in Skyward Training. Schools are accountable for all medications administered. Therefore, any errors or incidents must be reported. Why are these reports necessary? Because they document and explain the error. It is also used to prevent future errors and to notify the appropriate people. It is not used to place blame.
This is an example of the medication incident form. When completing an incident report, be sure to fill in all blanks, including date and time with full description of the error, what corrective action attempts were taken, and a plan of action to prevent future errors from happening. Be sure to indicate if and when emergency services and/or parent was notified. The report should then be signed by the person that was giving the medication, the school board nurse, and a school administrator. Reports are then filed in the clinic personnel training record binder. Requests from parents for a copy should always go through the legal department. During a field trip, students must receive their medication just as they would at school. A parent may administer medication to his or her own child if they attend the field trip. However, the school cannot require that the parent or guardian attend a field trip, regardless of the student's condition or medication required. This is the law. The parent may choose to withdraw permission to give the medication on the field trip in writing, but the school should never contact the parent to ask them to do so. A copy of this permission should be on file in the student's record. The school board nurse and clinic personnel should always be notified at least 2 weeks in advance of a field trip in order to prepare and train necessary staff or personnel.
Extended and out-of-state field trips will require individual planning for students who need medications that are not authorized or able to give themselves. The school board nurse and clinic personnel should be notified at least 2 weeks in advance of out-of-state field trips in order to prepare and train necessary personnel or staff. If additional medication is needed, or medication is to be administered at times other than as stated on the current authorization, a new or additional authorization will be required. Arrangements should be made in advance with clinic personnel if medication needs to be signed in or out after school hours. SCPS employees should not carry medications for students who are authorized to carry and self-administer their own medications.
Prior to a field trip, teachers are responsible for notifying the clinic personnel. Adequate time is needed to prepare paperwork and plan for additional trainings when needed. Clinic personnel are responsible for preparing the required paperwork, which includes the field trip medication log and administration record, as well as a copy of the authorization form. The teacher or other trained staff member should schedule an appointment with the clinic assistant to prepare and count medications for the trip. Confirm that you are preparing the right medication for the right student with the right authorization. The field trip medication log and administration record is to be completed per student per medication. This means if the student needs 2 medications on the field trip, each medication will have its own form. The first section indicates what is being checked out of the clinic. Be sure all blanks are completed. A count must be performed, and the medication must remain in its original container. The trained school personnel or teacher checking the medication out of the clinic must acknowledge the responsibilities required while maintaining the medication. This document goes with the responsible staff member on the field trip. Section 2 is completed by the staff member when the medication is administered on the field trip. Section 3 is completed upon return to the school. Medications must be delivered directly to the clinic, and a second count must be conducted and documented.
During the field trip, personnel who sign out medication retain responsibility throughout the field trip for carrying and administering it. Staff carrying a student's emergency medication must remain with that student. If medication requires refrigeration, accommodations must be made. A cooler with ice packs may be used.
On return, unused medication in all forms should be taken to the clinic as soon as possible. Medication must again be counted and recorded on Section 3 of the field trip medication log and administration record. Clinic staff should then review Section 2 of the form for date, time, amount given, and initials if the medication was administered. Clinic personnel should then appropriately document in Skyward that the medication was administered during a field trip by the teacher. The field trip medication log and administration record should then be uploaded to the student's health record in Skyward. Counts of all controlled substances must be conducted and documented weekly per medication. This will include all ADHD medications, seizure rescue medications, and even the controlled substances kept in classrooms. If you're not sure if a medication meets this criteria to be counted weekly, please reach out to your school board nurse to get clarification. Insulin stored in the clinic will also need to be reviewed weekly and documented on the weekly insulin storage record for each diabetic student. All unused insulin should be stored in the fridge until opened for use. Once the insulin is open for use, be sure it has the pink "Do Not Use" label and it's still within date.
Parent or legal guardian should be notified when unused or discontinued medication is left at school. Notification can be in writing or by phone and should be documented as a health note in Skyward. A parent notification form is available. A deadline for pickup should be specified, and if not picked up by then, the medication should be destroyed. All medications should be picked up by the last day of student attendance unless attending summer school at the same site. Be sure to remove the medication that was picked up in Skyward inventory by adding a record with a negative quantity of the amount checked out and the appropriate note. If student is attending summer school at another location, the parent must pick up the medication and authorization and deliver it to the new location. Do not send meds in the courier system. Guidelines for proper disposal of medications are described in the Health Services Manual. Contact your school board nurse for further information. The school is accountable for all medications to be administered at school. The medication audit is used to monitor and document the proper and safe administration of medications. All medication forms are considered legal documents. Any paper forms should only be completed using blue or black ink. If an error is made, put a single line through the error and write "error" and your initials. Do not use whiteout. The school nurse will observe the designated employee for proper medication administration techniques. The nurse completes formal medication audits at least once a year, and results are given to the principal. Additional audits and observations are conducted as deemed necessary by the school board nurse. This completes the training on Seminole County's medication policies and procedures. Please contact your school board nurse for any questions regarding this training.